Atsushi Ogura, are you ready to pitch?
Yep.
Yes, so please give a warm welcome to him.
Hi, everyone. Thank you very much for the opportunity to talk here. My name is Atsushi Ogura from Novelgen. So today, I'd like to talk about the Novel Glue, which is bioadhesives with strong wet bonding without written consent. So we'd like to talk about the medical adhesives. Medical adhesive is very convenient and essential for the surgery. There is less risk of secondary infection and less tissue damages than statuettes. However, there is some problems. For example, they have less strong than stitches in wet conditions, and the risk of viral infection and written consent required. So our mission is to promote worry-free surgery with safe and strong medical adhesives, eliminating the need for the written consent. So our solution, so we can make the better medical adhesives from marine organisms. This is mussels. They have very strong glue. They can adhere to the soft and wet, and which is very strong. However, to correct these glue from the marine organism is very difficult, even though it is very tasty. So that's why we'd like to develop this glue from the synthesized, genetically synthesized from the microorganisms, eliminating the need for the written consent. And we already achieved 16 times better bonding strength in a wet environment. It's about 0.8 megapascal, which is almost 16 times better than the current product, right? So the global market, the medical adhesive market is very huge, like 8.8 billion USD with a CAGR of 7%. So our product can replace the current product, right? So, however, even though this is very huge global market, can we target these large market? That's why we'd like to find the niche market to start with, right? So for the interviews, we are asking several doctors, what is the niche market for this product? So one plastic surgeon, he said that adhesive cannot be used for surgical treatments due to strength issue. And however, when stitched, the cartridge would get torn by the thread. That's why he needs a new treatment method with new glue. Dentist, he told me that adhesives are not widely used in the oral cavity because of the weak adhesive. But if stitches are used, secondary infection due to plaque must be addressed. He also needs a new treatment. So we are developing the product like this and tailored to these unmet needs. So we already conducted several biological tests for medical devices, but this is at the time prototype of novel glue at the non-GLP level. For example, test for irritation and skin sensitization, we passed. And a test for in vivo cytotoxicity, test for genotoxicity, and so on, we passed. But we need GLP level products. That's why we need the partner for the manufacturing. At the current situation, we are preparing the production to the GLP level. Also, we are developing the treatment method with the Faculty of Medicine. And the manufacturing patent and the functional patent are pending. Also, we found that our novel glue has a different function, like cell proliferation and wound healing ability. We confirmed this at the cell level. For the TAM, SAM, and SOM, even though the market is very huge, we'd like to start from the small market, like we can reach, such as plastic surgeon and the dental surgery, and so on. But the estimation of this market is around 300 million USD. Also, we'd like to reach to the different market, for example, high-class eyelash adhesive. Eyelash high-class eyelash adhesive can be used in a beauty industry, right? Many persons has an allergy to the current glue. That's why they need different types of glue. Also, we can reach to the tissue regenerative adhesive. We can create this kind of new market. And at the 5 or 6 years later, maybe we can access to the different level, like where it is important to bond it in a wet and not to require written consent. It is estimated around $1 billion USD. So the business model and the timeline. So our business model is licensing medical adhesive patents to pharmaceutical companies and receiving licensing fees. And to secure revenue until the PMDA is completed, we'd like to access to the eyelash adhesive and the tissue regenerative adhesive that can be developed in a short period of time. So our vision is to ease patient concern about written consent and to support doctors also with safe and strong adhesive in surgery. So we are currently seeking a collaboration and investment. Novelgen is Class 2 medical devices and requires PMDA application. Application also requires production line and the GLP standards. That's why we are seeking manufacturing and pharmaceutical companies. Also, we are seeking investment. This is very important to secure high-level human resources to carry out these R&D activities. Thank you so much.
Thank you very much.